So for many people, they come with acute episodes of disc herniation. So one of the best procedures that I do as a pain management specialist is for an acute disc herniation. An epidural can be a very impactful procedure. And so a lot of times, as a physician, getting quicker results is ideal for us and the patients. And so an epidural injection is something for an acute disc herniation that can really provide people very quick improvement, return back to activities. And so a lot of times people, without the treatments that we're able to offer, are not able to get those improvements. And so a lot of times for acute disc herniations, acute compression fractures, chronic persistent pain that's really refractory to multiple different treatments, a lot of times the options that we have for pain management really can provide improvement that other specialties are not able to capture. Yes, so one of the most gratifying parts as being a pain management physician is being able to provide people with functional improvements. A lot of patients are hoping to be able to play tennis again or play golf again, be able to dance or pick up their grandchildren. And although not every pain symptom will improve with certain treatments, a lot of times we're able to improve patients' quality of life enough to be able to achieve those milestones they're looking for, whether that's playing tennis or playing golf. And when patients come back satisfied that they're able to get these things accomplished, it's a very gratifying feeling. I would hope to hear that my patients think that I am compassionate, empathetic, I have good communication skills, and that I am able to hopefully communicate effectively what treatments I'm providing, answer questions effectively. That way patients understand what we're providing treatment for, what their underlying process is, what their treatment options are, and what they can choose from of those things. I would also hope to think that people would say that I'm skilled with procedures and different surgical interventions that we do perform. And so I would hope that people think I am a caring, compassionate physician with a skill set that provides them the goals and improvement they're looking for. I like to, try to have open conversations with my patients and have, whenever there's, time or availability, to get a conversation in to discuss things besides the pain management we're discussing, to learn a little bit about them, and also allow patients to learn a little bit about me. And I think the biggest thing that allowed me to improve as a pain management provider, I actually had an injury last year where I sprained my left knee. That really was a setback. It made day-to-day tasks a lot more challenging, walking around the office, being a dad, being a doctor. I think that experience was very humbling and allowed me really to understand a lot of the aspects that patients are dealing with. I was not able to do a lot of the things I enjoyed, like playing golf or lifting my kids for quite a while. And so I think a lot of times, having relatable injuries, not being able to do some of those things, allows you to understand what patients are dealing with. And I myself was both a patient and a physician at the same time. And so I feel like those skill sets and those experiences kind of mold the physician you become. The general concept when I meet a patient for the first time and try to address their pain is to focus on where are the pain symptoms clearly, address diagnostically or in whatever modality we need to, what likely are our pain generators. And I'm a big believer in educating patients on why I believe they have pain symptoms, what their available treatment options are, whether that is medications, injections, physical therapy, bracing of some sort, discussing further care with a surgeon. I'm a big believer in explaining why there's pain, what available treatment options that I can have and other providers have as well. And then from there, allowing patients to make a decision about what sort of treatment options they want to hopefully improve their pain symptoms.